All right, so welcome back, everyone. So cataract is the leading cause of blindness, causing 42% of blindness worldwide. However, accessing cataract surgery is not always simple. As June is Cataract Awareness Month, the Trinidad Eye Hospital wants to highlight the various ways that the public can access cataract surgery by hosting a webinar. Tell us more about the webinar is Prianka Persad, Surgical Services Manager at the Trinidad Eye Hospital. Ms. Persad, thank you very much for joining us this morning.
Good morning. Thank you for having me.
Of course. Ms. Persad, before we get into the webinar, what's the situation locally when we're speaking about cataracts?
So we've noticed that, since COVID came into play, the public sector really did not have a lot of surgeries happening because of COVID. And so a lot of patients were forced to move from the public sector to the private sector to get surgery. So the public sector had a waiting list, and there was a very, very long waiting time. And a lot of people remained on the waiting list without being able to access surgery. And so moving to the private sector was the next step for them. Of course, moving to the private sector means that you have to pay for surgery, which is another problem, the challenge that patients face, because, again, with COVID, a lot of challenges came about with finances. So within our practice, we've created a couple different solutions so we can help patients to access their surgery and also to make it more affordable to them.
Yes.
So we would like to discuss those points in our webinar.
Of course. What is contributing to cataracts among people?
Cataract is generally an opacification or clouding of your natural lens in the eye. And this is an aging change.
Yes.
So as we get older, the lens in our eye becomes aged. And so as it becomes cloudy, our vision tends to become blurred. So you might notice a drop in your vision and also other associated symptoms like glare, halos, colors may seem a bit faded. You might have problems driving at night. Reading may become challenging. So any of these problems that you notice, any symptoms, you should definitely go to your eye care professional to have it assessed.
Is there or has there been an increase in cases?
We've not, I wouldn't say an increase in cases, but we've definitely seen the numbers becoming a little bit more because a lot of people have been waiting.
Yes.
So they've been delaying surgery for whatever reasons, financial or whatever. And so because of the delay, now the numbers are seeming as though they're enormous. But I don't know if it's actually because there has been a lack of services in the public sector, or if it's just because patients have been, putting their surgeries off, or it could be a combination of both.
Yeah. Let's speak a little bit about the surgery, because there may be a bit of fear among people who have to take this surgery. What does the surgery, the process entail?
Of course. So a lot of people, when they hear eye surgery, they tend to become fearful, like you said. And so I believe that fear prevents them from proceeding with their surgery or causing them to delay that. So we want to remind patients that cataract surgery really is a simple procedure. It's a quick procedure. All we do is we anesthetize or numb the eye that's being operated on. Generally, it's a surgery that's done with the patient awake. They will not feel any pain because the eye is being numbed. So they would be able to go through the procedure without pain. The doctors will then go in, they will remove that clouded lens and replace that with an artificial new lens. And that whole process takes about 15 to 20 minutes. So again, it's quick, it's pain-free, and that's it. So the patients now, or the general public listening, you don't have to be scared about doing cataract surgery, so don't let the fear prevent you from getting your vision back.
Yeah, but what is the aftercare like?
So different practices will advise their patients differently. generally, we would ask our patients to avoid any dusty or dirty activities or avoid getting anything in the eye, because if anything goes into the eye, post-operatively, they can risk having, an infection. We don't want to have that happen.
Yeah.
So we really just ask them to be careful. It does not cause the patient to become bedridden or anything like that. So patients can still move around. You can still look at TV. You can still do some reading, as long as you adhere to the guidelines given by your doctors.
Yeah. Ms. Persad, let's speak now about the webinar, and let's speak about what are some of the components, what are some of the issues to be discussed at the webinar.
Sure. So, like you alluded to initially, cataracts is one of the leading causes of blindness worldwide, and it accounts for 42 to 50% of avoidable blindness globally. The World Health Organization actually approximated that about 94 million people experience some form of distant visual impairment or even blindness due to cataract. So Trinidad Eye Hospital during this month has taken the initiative to use this platform to raise awareness about cataracts, and we would like to focus on a couple key points, which would be what is a cataract, obviously. We'd like to move into surgery to inform the public about what the process of surgery entails, to also alleviate their fears about surgery, and talk about the ways that you can access surgery at our practice. We're also going to talk a little bit about the financial options available at Trinidad Eye Hospital, and also touch in a bit on the use of glasses after surgery. So we will have myself together with our optometrist and one of our doctors on the panel discussing these points.
When is the webinar being held?
The webinar is tomorrow. That's June 5th. It's going to be at 6:30 p.m. We're asking the public to just go to our social media page, our Facebook page, click on the link, and you can register easily.
So it's not a situation where people have to register. You just go on to and you'll be allowed into the webinar.
We are asking them to register. So
Okay.
you click on your link to register.
Yeah.
Yeah.
All right. Ms. Persad, anything else you'd like to speak about that maybe we didn't touch on at all, that you would want people to know?
I would just use the opportunity to remind patients that, your eyesight is a gift. So if you are experiencing any problems with it, you should definitely go and get it checked, whether it's with your optometrist or your ophthalmologist. As long as you're getting it evaluated, that is the key.
Yeah. And we did speak about people procrastinating, not wanting to go to do the surgery. But isn't it a situation of time is of the essence, really?
Generally, with surgery, the sooner you get it done, better for the patient. Cataracts can be treated at any stage now with modern technology. We don't have to wait for it to become ripe, as they used to say before.
Yes.
So at an early stage, it can be treated. If you wait, the cataract will continue to progress, and so the patient's vision will continue to drop. And of course, blindness is something that we can look forward to if we don't treat it. So basically, we ask the patient to come in earlier so that it doesn't continue to affect your routine daily activities.
Is surgery the only option, or are there other options available? I think I can hear people saying now, is there a drop that they can use in their eye to help them, or is surgery the only option when it comes to cataracts?
Well, we've heard a lot of things. We've heard putting castor oil in the eye, honey in the eye. We don't have any scientific evidence to back up those statements. So at this point, surgery is the only option for treating cataract.
Yeah. All right, Ms. Persad, before you leave us this morning, could you repeat again how do people sign on to the webinar and register for the webinar?
Sure. So you can visit our Facebook page, Trinidad Eye Hospital. You'll see the link. Just click on the link and register. Alternatively, you can contact us at 235-4834 for any other information that you'd like to.
Yes, Ms. Persad, as always, thank you very much for speaking with us this morning. We do appreciate it. Bye for now.
Thank you.
Okay, so it's time for another break. We are coming back.
Over the years, he began to grow.